Sure. And other people? What else do you have? What else are you going to go looking for?
History of hospitalization, duration of symptoms, what medications are you taking? I don't know.
Okay. So you're going to get clues from the medications are on?
Yeah, we can.
Hopefully.
Okay.
Asthma.
And what are you going to look? I don't know if anybody got down. I didn't get to anxiety.
Yeah.
But
History of anxiety.
okay.
Again, you're going to have sometimes a shortness of breath, wheezing. Palpitation.
Okay. So imagine none of you do this before you go in to see a patient. But how many do this mentally? Yeah, and that's the thing. Our students, at some point, learn to do this mentally. But as a third-year student, this is all really formed. And sometimes giving them a form to structure their thought can be really helpful. Again, you've all been doing this for a number of years, so it's easy to figure out about anxiety, about what you're going to look for. And for a third-year medical student, it's pretty difficult. And the more help we can provide them with, the more structure. You know, we often will give them the structure about, okay, you need to present in a very structured form. And although I find that really important for me to understand what they know, I'm not sure that helps their thinking as much as, okay, let's just talk about the possibilities. Let's talk about, let's put up a shopping list of what you're going to be looking for. So one way we can help our students is just tell them to follow these steps. Generate the differential. They should estimate kind of likelihood of different things. Look for additional information. Revise it. And in fact, William Osler also suggested this is not a bad way, that a lot of medicine is about probabilities. I'm going to skip over this because of time. What emotion is angry? What's that?
He's angry.
Yeah. And what tells you it's anger?
Brown.
Okay.
Looks like he's been yelling.
Not a happy camper, right?
She needs to brush her teeth too.
Somebody just told her that she was on call.
Maybe it's a he, yeah.
Okay, and this is just recognition. In fact, most of you are probably thinking, oh, there must be some kind of trick. That picture, it's obviously anger. This guy is wily, he can look out. But the point is, with this recognition, it's easy to figure out that you're angry. And you appreciate it. And in fact, when we do pattern recognition in medicine, there's in fact a relationship between the amount of time it takes us to recognize a pattern and our accuracy. What's really interesting is that relationship is inverse. The longer it takes us to shout out the answer, less likely we are to be correct. Okay.
I already said it.
So what's the
I already
diagnosis?
said it.
What's the diagnosis? Okay.
Glutate psoriasis.
Okay.
Glutate?
Yep. Big words for you.
Can anybody give me a diagnosis?
Right below the pneumonia.
Okay. And what do you see? Yeah. Absolutely. So this was actually a child that I admitted about a week ago. And what's the diagnosis?
Down syndrome.
Down syndrome.
Right. Okay. So I know it's Downs. How? What did you see?
The rest of them.
Poppyville fissures.
The way the face looked.
What about the face? I'm a third year student.
Eyes.
Oh,
The eyes.
doctor, you mean any child with a plaid vest must have Downs? So no.
The almond-shaped eyes, the flattened nasal.
Okay.
Low set paprika fissures.
Okay.
Like,
The weird face.
yeah, it says the weird face. Yeah, the ears can be actually low set too.
The tongue's all right.
Weird
Yep.
faces.
Long time.
Mouth, and it looks like a big tongue. Most of
Yeah.
the ears. Absolutely.
I think I have really big brownie with nuts.
So a lot of medicine is pattern recognition. I got this hypothesis stuff
Do you need me to help you with the motion?
because when you see somebody with Down, you see psoriasis, you don't go through the whole differential. You just know what it is. And we've talked about visual patterns. There are auditory patterns. At one point I was in the public health service and we saw a lot of peritonsillar abscesses. And you get very used to how people speak with those. Olfactory. Are there any unique smells that...
The GI bleed.
Okay, I've never heard that. Okay.
Child with PKU.
Okay. So these are unique smells. You smell them. You know, when I was a third-year student, my resident took me on surgery to the OR, where we had a woman with diabetes with a big abscess in her thigh, and he incised it. All this prelim material came out, and he said, "It smells, George. This is an anaerobic infection." And yeah, you only have to smell it once to know it. And some of the patterns are more complex. Actually, most of the patterns are more complex. So that when somebody presents with DVT with swelling on one side, she's female, she's a smoker, she's just been on a car trip, DVT pops up very quickly. You aren't taking the complete history because you recognize this pattern so well.
I'm more worried about who gave her the birth control pill.
Mhm.
A smoker? Being a smoker, and how old is she? That's the other question.
Just menopause.
And is she pregnant? That's the other thing, you know, it's wandering in my head. Sorry.
He's Dr. Gia.
Always look to see you screwed up, right?
Yeah.
You're always looking to see you screwed up.
Yeah. Make sure it's
Okay, so what's this?
Woohoo!
What kind of dog?
Terrier.
A terrier. And what kind of terrier?
Groomed.
Too big for a rat.
Actually, I'm not a terrier expert. It turns out it's a wire fox
Straight
terrier. I can't
tail.
tell you why. But many of us saw this as a dog. Other people saw this as a terrier. So what about this dog tells you it's a terrier?
That
Little beard.
shape of the face, shape of the muzzle, and the kind of the mustache kind of haircut he's got going on.
The hind legs too.
And
Yeah.
the stance, the front stance, how it's, broad, the front chest.
Yeah, the tail looks so weird.
Good.
It's a cut tail.
And in fact, students do get better at pattern recognition. This is from 5 different schools. So they test their pattern recognition before they come to medical school, at the end of the first year, second year, third year, and they get better. So
School A's
you
not
get
doing
things
that.
out of medical school.
Looks
School-
like it's
is School A
tapered off
Iowa?
at the end there.
You know,
Let's
yeah.
see.
What do you think that's about?
Yeah.
It's Iowa.
Yeah, that's a good observation. So what do you think could be going on?
The plateauing, they're going to, the brain's full.
The brain's full?
That's I think the studies.
They're peaking out. They're peaking, yeah. They're peaking. Can't shut
So the only way to know that that's a terrier is that somebody is kind enough to teach us a terrier. And they point out the stance with the mustache, because it's not intuitive to us that it's a terrier. In fact, we could look at it, the same thing with the Downs. You think, oh, that doc knows it's a Down. It could be the plaid sweater, could be the color of the hair. But somebody at some point gave you the specifics. They walked you through it. So we certainly can help our students by providing explanations of these patterns. And I find this really hard to do because it's so obvious to me that psoriasis is psoriasis. How would it be anything else? And I feel like I'm kind of insulting them by saying, oh, look at the salmon plaque, look at the silvery scale, look at some of the extensor surfaces. And I really have to get over that if I want to be an effective teacher. And what's curious is that we can teach our students with real examples, and we can teach them with simulated ones. So in 1987, I was a public health service in Ketchikan, Alaska. And one day my nurse, Martha, who was a very good nurse, came out of the room and said exactly this. Oh, Dr. Bergus, your next patient is Christopher. Poor little guy, he's got a viral infection. He looks so tired. Why don't you tell his mom to take him home and put him to bed?
You said no.
I said, okay. So I opened up the door, and I took a half a step in, and I heard somebody yell in my ear, meningococemia. Has anything like that ever happened to anybody else? Something, yeah. And I actually heard it. That's happened a few times, Mike. And you can imagine Martha's face when she saw me running out of the clinic, headed next door to the hospital. I'm yelling at her, tell the ER I'm coming with a kid who's seriously ill. Now, I'd never seen a case of meningococemia. But in my residency, somebody on my PEDS rotation thought it was really important that I be able to recognize it. So he had videotapes of kids in this SICU with meningococemia. And he showed them to us. He pointed out the petechiae, about the purpura, and how this is a life or death thing, and if we see it, we need to do it. And here I am, about 4 years later, running across the hospital with a kid that, because somebody had been kind enough to point this out, I got it. And most likely, if that person had not shown me those videos, I would have said, oh, poor Christopher, why don't you take him home? So, how do we make diagnoses? Well, when you're expert at something, you certainly just recognize it. For easy cases. For hard cases, we tend to generate hypotheses early, and we call that a differential. We go for specific pieces of information. Oh yeah, Nelstein did notice that every now and then experts did shift to this do everything, complete review of systems. Did you ever have chicken pox? Have you ever had a tattoo? Have you ever, et cetera, et cetera? And when he asked the physicians what was going on, the physicians typically said, I had no idea what was going on. I was just fishing. So there used to be a big debate about whether physicians use intuition or use analytical reasoning. And this intuition is certainly fast, it's effortless. But as we saw with that pattern recognition, at some point you kind of peak and it's kind of slow to improve. I think the other reason why it's slow to improve is that at some point it's kind of hard to admit that you don't recognize, and it's hard to go to somebody and ask them for help recognizing a pattern. Physicians use this kind of slow plotting and analytical reasoning. And what makes somebody expert is that they can use both, and they can use them together. Okay. How long does it take 10 machines to make 100 machines to make 100 widgets? Shout it out.
Five minutes.
1 minute.
1 minute.
No, that would be 5 machines, 5 minutes.
No,
So 100 would be 5 minutes.
it takes 1 minute per one widget.
1 minute per one.
1 minute per widget. You're gonna get to the rate, and then take the rate times the machine.
So really?
That's one machine, 5 minutes. But it takes each machine 5 minutes.
That's fine. I'll let you go.
Each machine makes one widget.
The average IQ of this room is
So it takes 5 minutes. I've come up with both the measures.
5 minutes, yeah.
5 minutes.
Yeah,
Ooh,
5
5
minutes.
minutes. 5
This
minutes.
is not really a widget test. This is that your kind of intuition can lead you astray. And it's not for people that said 5, you're right. And in order to get the right answer here, you almost have to use your analytical brain to kind of dampen down your intuition. Because most people will feel a need to say 100. They see 555, 100, must be 100. And somebody that has studied intuition a lot, Robin Hogarth, says that one of the things we need to do is train our brains, our analytical system, to kind of monitor our intuitive system and make sure we got it right. Yeah, it sure looks like psoriasis, but is that a common disease? And if it's not, you might want to question your diagnosis. He says that we ought to use our analytical brains to just double check and not jump to conclusions. Does your diagnosis make sense? So does anybody have a diagnosis for this?
Folliculitis.
Okay. There. Other things?
Upper underbottom.
So yeah, but I don't know if the bottom one is the same thing.
It's the same thing. Same person.
And now it doesn't look like this.
Carbuncle.
Is that raised or not raised?
What's that?
Is it raised or?
Raised or flat?
It's raised.
Does the smiley face configuration mean anything?
What kind of question is
Smiley
that?
face.
It's a tattoo gone bad.
He's thinking outside the box.
I
Okay.
usually do.
So I got a call from the emergency room Friday afternoon, 5 o'clock.
I know what it is now.
Just not quitting time. We've got this guy down here. We think he's got some kind of vasculitis. We're not quite sure what's going on. His platelets are okay. But we can't send him home. So I went down there, and it was kind of weird. I looked at that, I felt it was kind of bumpy. And I said, oh man, I've seen this before. I said, yeah, it was when I was a 4th-year student. I was on dermatology. They had the All Philadelphia Dermatology Society. You know, 6 medical schools in Philadelphia, so a lot of academic stuff. And the resident I went there with said, "Ooh, go see this guy. He has scurvy." So I said, "Oh man, I can't tell my residents I think it's scurvy. They'll think I'm really crazy." But then I started thinking, okay, now what was really unique about that guy I saw as a medical student? Well, he's a middle-aged male.
It's positive for gonococcal.
He was a middle-aged male. He, let's see if we can get this back here. There we go. Whew. Whoa, onset a couple weeks ago, just like that guy in Philadelphia. His legs were involved more than his arms. His teeth were falling out. The guy I saw was an alcoholic, so of course I asked him. Yeah, he admitted, "I'm not going to lie to you. I like drinking."
Get him a lime.
And then
Was he a sailor?
the guy in Philadelphia, this is no kidding, he only ate canned lima beans.
Really?
But apparently when you can vegetables, you totally destroy the vitamin C. So my grand finale question to him was, what kind of vegetables do you eat? He only ate canned vegetables. Well, so I kind of thought my chief complaint, kind of came up with a diagnosis. Intuition could be vasculitis, but how about scurvy? I asked my questions from the one case of scurvy I'd seen. So, you know, the residents said, okay, well, we should rule out vasculitis. We're doing a biopsy. You know, we can get a derm consult. And I said, you know, I think it might be scurvy. We ought to measure vitamin C. Of course, their eyes rolled back. And, oh, here goes this weird professor guy again. Well, it was Friday. And, of course, dermatology doesn't consult on Friday or the weekends.
Your vitamin C level came back well a bit.
But on Monday, they said, oh, classic case of scurvy. No need to measure vitamin C. They just, I mean, they could diagnose it as scurvy from the doorway. And here I had been slowly plodding through it, trying to match it up. So how can we help our learners get better? Yeah, we can get them to combine their intuition and their analytical reasoning. There's actually good data that by having them do that, they're better. So this is some work done with internal medicine residents. They gave them paper cases. For one group of residents, they tell them, just write down the first diagnosis that comes to your mind. The second group, they said, okay, yeah, put down the first diagnosis that comes to your mind, then go back and read the case again. And list those findings that support your diagnosis, those that oppose it, and think of alternatives. Now what's clever is that they actually gave these residents easy cases and hard ones. So the easy cases, there was going through this labor-intensive, this mind-intensive process, really it added nothing, right? Once you recognize psoriasis, it becomes an academic thing to think about other alternatives. In fact, it's really bothersome because it's so obvious. But look what happens when you give them really difficult cases. Yeah, they're actually significantly better when you ask them to be very purposefully about writing down what they think is going on, try and, describe what supports that, what opposes that, and then come up with other diagnoses. So let's go back to our 70-year-old woman. In fact, you've got the story there on the brown sheet. And I've got two diagnoses. So I'm hoping that you can work with people next to you and just read her story. What history findings are supportive of that diagnosis? What oppose it? What would you expect to be in the history, but you don't find there? And the same true with the physical exam.